The problem is that with mantle cell lymphoma, we do get really high response rates with chemoimmunotherapy. I think one challenge, though, is trying to determine how to best treat patients in the frontline setting. There's no clear standard. It can be variable and really depends on patient and disease-specific factors. So when we do see a patient who has a relatively aggressive disease course or is symptomatic and does meet the indication for treatment, treatments can vary anywhere from rituximab monotherapy to chemoimmunotherapy with or without an autologous stem cell transplant. There is a lot of question as to whether patients do need to be consolidated with an autologous stem cell transplant. And there's also questions as to whether rituximab maintenance is appropriate in the frontline setting, depending on what kind of treatment the patient is started on with respect to induction therapy. And certainly there's an important cooperative group trial that is trying to answer the question of whether an autologous stem cell transplant is needed across the board in mantle cell lymphoma. So certainly the challenge is picking the right therapy for patients. Another big challenge is the fact that despite the therapies that we have available, patients do relapse. And when they relapse, their outcomes tend to be quite poor.